Hi everybody, I'm Dr. Ashutosh Kumar. I'm a cardiac electrophysiologist at Care Hospital, Hyderabad. I'm clinical director for this division. And today I'm going to discuss something very important, what we call syncope, because most of the time this patient shunts between two departments, neurologist and cardiologist, and sometimes it is under-evaluated or not treated properly, and a lot of casualty happen in this patient being evaluated for other reasons. So first of all, let us understand what syncope is. So syncope means loss of consciousness with spontaneous recovery. We technically, when somebody all of a sudden fell down and he immediately recover and say, I am doing fine. So that episode which you have seen, somebody is standing for a long time and all of a sudden collapses and then recover within seconds I am saying, or maximum by within 30 to 40 seconds he is recovering. It is called syncope. And the cause is that heart is not able to push the proper amount of blood to the brain, so that the person is becoming unconscious. So it is more a circulatory condition than a electrical problem of brain. So let us be clear that if somebody is having this type of symptom, he should be evaluated by a cardiologist, and particularly by the electrophysiologist who will see from the rhythm point of view whether the rhythm disorder is cause for this type of condition or not. Elderly patient comes with a syncope and they underwent CT, MRI, and most of the time it turned out to be normal. And sometimes they are even evaluated by the cardiologist, by the angiography, and most of the time it turns out to be normal. But there are some investigations that need to be done depending on the frequency of this syncope. If it is happening daily, you can put a halter and we will get the information the rhythm disorder is cause for this thing. We are having rhythm monitoring system which can last from 1 day till 3 years. 3 years we can rhythm analyze the patient by the cloud connected technology. So we implant some device and that will give all the beat to beat information to the central unit, and we can trace the disease where it is. So if the patient is having very less frequent syncope episode which is happening in a 1 or 2 year, also we can evaluate and treat it. Coming to the what are the syncope where we should be very much alert. So if it is for a pilot or driver, it should be thoroughly evaluated, because the stake of the persons whom he's carrying on the road, both are on the problem. Persons who are having head injury or who has injured themselves during the syncope episode. So those are the patients, or the patient who is having family history positive for sudden cardiac death, or patient is having weak heart, or patient is having already heart diseases. So this type of patient, if develops syncope, it should be taken very seriously and it should be very aggressively evaluated by the cardiologist, electrophysiologist, and neurologist also whenever needed, depending upon the symptoms. So coming to the syncope is a very common condition, but most of the time it is vasovagal. If you are straining yourself too much, it may happen. But if it is coming without any reason and a particular background, yes, that time it has to be evaluated and treated well, so that we can avoid the casualty. Thank you. See you next time.